Okay, so now we're at exercise number 9, and this is about first aid for pressure related injuries and oxygen administration. And obviously, we're going to see the two things that needs to be completed with this exercise, but always keep in mind, right? Something that's really going to help here is to include the oxygen provider course in your rescue diver course, right? And this way they'll really feel comfortable. They look at different techniques and so on. But for this exercise, as we always do, we follow our cue cards. And in the cue cards, there are two things we need to do. One is to show and demonstrate the recommended steps and procedures for administering oxygen to a breathing, unresponsive diver who is a suspected DCI. The second thing is also demonstrate the recommended procedures now for delivering either mouth to mouth or mouth to pocket mask, rescue breaths, and also administering some oxygen as well. So we're going to see that. So for the first exercise, we have a diver who came up and maybe complained about some pain after the dive. We might suspect DCI or some pressure related injuries. So we're going to administer oxygen. And so in this case, the diver is complaining of some pain. I'm turning on the oxygen unit. I've attached a demand valve regulator, and we have a TrueFit mask on there. This is going to provide 100% oxygen. So in this case, once it's turned on and ready to be provided, the first thing you want to do is make sure that it works, right? We don't want to provide a mask and the oxygen is not flowing. So it's very simple. You take a breath and then exhale away from the mask, right? So now I know it's working. This is a drug, so we need to ask for permission. So if he's conscious, I can ask him, hey, this is oxygen. It may make you feel better. Do you want it?
Oh, sure.
All right, and then I'm gonna provide that. So you can put this on your face. I'm gonna ask you to hold it if you can, and just breathe and relax, right? And so they're simply gonna breathe and relax, and that should work well, right? If they become unconscious, so if suddenly they become unconscious, they would drop this. Then I have another way to also provide oxygen. So this way, I'm not gonna use the demand valve. However, I'm gonna use a non-rebreather mask. And so for this, I would take the non-rebreather mask, attach a hose to it, like so. And then with this, I'm gonna attach it to the free flow function of the multifunction regulator. Just attach it here and then provide 15 liter per minute. So I set it up on 15. I grab this non-rebreather mask. I'm gonna prime the bag, make sure it's flowing. And as I know it's flowing now, I'm just gonna make sure it fits well on the face of the victim. Here we go. And just try to get a really good fit, right? If you have a good fit, then the most oxygen is coming out. And so if it's a breathing unresponsive diver, then they can also breathe oxygen like that. Okay, so that's for suspected DCS or issues like this. Okay, so now the second part of exercise number 9 is now dealing with unresponsive non-breathing divers. So we'll see that we can also provide some oxygen in that case. So here I got the patient, and because they're not breathing, I'm going to be using a pocket mask, as you can see here. And as usual with CPR, we'll start with compression. We'll do 30 compression. And then 2 breaths. And then I would continue. Now, with this technique, what we can do as well is add oxygen to our breath. So don't install anything on the patient's face. Always remove the mask. As you can see, there's a little inlet here. I'm going to attach this clear hose to the multifunction regulator on the oxygen unit, and then simply attach this here. All right, so this is why you don't do it on the patient's face. Now that this is on, I can reposition the pocket mask, and as it's positioned now, I want to open it to 15 liters per minute, and now we have oxygen flowing that is added to the breath we give. And then you would continue with compression. Okay, so in closing with exercise number 9, because you'll be assigning buddies, they all take turns in demonstrating these skills. You'll see that really promoting the oxygen provider course will help really, because they'll do all that, right? There's even a time where you'll ask them to assemble and disassemble the unit, which is also part of that course. So that makes sense, but certainly take your time, have everybody involved in it, being confident that they can provide oxygen. If it's a pressure-related injury, maybe DCI, or if they're full cardiac arrest, we can still add some oxygen to the breath we give. So this is a cool exercise, and you will certainly enjoy teaching it. And if you have any questions, make sure you contact PADI.